Hi, good afternoon. My name is Tina Maiozzi, and for the purpose of this discussion, we'll be educating a patient on the medication Thiazide diuretics for which they have been prescribed for the treatment of uncomplicated hypertension. I will begin by first talking about what a diuretic is. A diuretic, otherwise known as a water pill, does its work in the kidneys. The kidneys are one of the main areas where water and sodium transportation takes place. Have you ever heard the saying, water follows salt? Well, for your body to release water, your body must be able to waste sodium. So, a diuretic aids in the process of blocking some of those sodium channels within your kidneys, thus resulting in more urination. So, how does this lower your blood pressure? That's a great question. First, I want to explain how volume can affect your blood pressure. I like to best explain it in terms of hydration and water. When we are adequately hydrated and drinking enough fluids, our blood vessels are happy and plump and able to do their job. Imagine water flowing down a river as the blood in our vessels flows. Well, in the case of dehydration, our blood vessels become sort of like a creek or stream where the volume of water is just not flowing as it should. Well, if the water is flowing as it should and the water pushes a force against the riverbeds, or what we can imagine as the river's pressure, if the water is flowing like a stream, slowly and barely touching the riverbeds, then the pressure along the sides of the river is lower. Therefore, if we decrease the volume of flow in the vessels, we decrease the pressure of blood flow and how hard your heart has to work. A diuretic works by reducing sodium, and therefore the water is reduced in our bodies. The sodium helps to remove the water from the blood through urination, decreasing the amount of fluid flowing through your veins and arteries. So when the diuretic causes the kidneys to remove more sodium and water from the body, it helps to relax the blood vessel walls, thereby reducing the blood pressure in your body. Thiazide diuretics are well absorbed from the GI tract or the stomach when taken orally in the form of a pill. They are distributed, readily absorbed, and bound to blood or plasma proteins. They are metabolized in the liver and they are excreted in the urine. Potential reactions and considerations are those with known drug sensitivity or an electrolyte imbalance. Used with caution with renal disease as to not further damage to the kidneys. They also have glucose elevating effects, so caution is recommended in cases with diabetes. Caution is advised in patients with liver disease and the elderly, and they may be more susceptible to side effects due to the drug interference and metabolism. So side effects to watch out for include low sodium levels and low potassium levels, dehydration, postural blood pressure changes, which is when we change positions and our blood pressure changes, fatigue, weakness, vision changes, and skin changes. Dosing variants may be necessary for pediatrics and the elderly based on the age and the disease state. Thank you.